Good evening, everybody. Thank you so much for joining me tonight on YouTube Live. I'm Dr. Howard Elk, the medical advocate, and tonight we're going to talk about one of my favorite topics, supplements. When to supplement, or when is supplementation too much? It's a really big topic because there's still a lot of health professionals out there, including doctors and, and dietitians, who still say, you get all the nutrients we need from our food source. Does anybody still believe that? I mean, seriously, I don't think the general public does because 80% of Americans are out there purchasing supplements every day. So they know better, and you as medical advocates know better as well. Um, and here's the thing: why can we not depend on our food source? Number one, the soil ain't what it used to be. It's so overfarmed. We lack so many minerals and nutrients within our soil that it's really hard to grow things now. Number one. Number two, also if you look at the whole process of commercial harvesting and shipping and food processing and who knows how long it takes to get from the crops itself to where it gets to your grocer and whatnot. So a lot of change takes place, which does affect the stability and the utility um, of the produce of the minerals and vitamins that we take. And then, of course, there's a whole question of pesticides and herbicides, and they're not going away anytime soon. So we can't just depend on our food sources anymore. It's just not what it used to be. We aren't living in the healthiest environment, and I think most of us know that. Um, and another thing, when I got interested in nutrition in the '90s, they were saying back then, okay, you got to have 5 fruits and vegetables a day, which like 1995 or so. So it's been a few years. Now that's up to 10. I mean, you really have to have like 10 fruits and vegetables a day to be considered anything healthy. Now, I don't know about you, but who eats 10 fruits and vegetables a day? I mean, it's pretty impractical, right? It's just not happening. So we can't afford to not supplement in this day and age. And that's really the topic. But I want to go one step further. When is too much? When is it too much? And there are a lot of people that believe in the latest supplement of the week. Like for example, I love Life Extension Foundation. They put out a great periodical on a monthly basis. They really do. And each issue, there's at least one, if not two, new supplements that I've never ever heard of. And they give you all this research behind it and how useful it is. And then about 3 pages later, there's an ad for that very same supplement. So, like, if I were to purchase every supplement that I see on Life Extension Foundation, I would end up figured out like 15 new supplements every year, in addition to what I'm already taking. That's crazy. I have people coming into my office with 1 or 2 shopping bags full of supplements. I look at them and say, wow, you must have the most expensive urine on earth because there's no way you can absorb all these nutrients. So it spills out in your urine. I've had patients say, hey, I see capsules in my poop. You know, overkill is not what we're aiming for. So what I believe in is targeted supplementation. I do believe in supplementation, but it's targeted. What are your goals? What are you trying to achieve? What is your basic health like? What is your health history? So a lot of factors go into decisions as to what you should be taking, and I'll help you out a little bit later. Now, what does the medical literature say about supplementation? Well, it's not a whole lot there because you don't have like huge, the gold standard in medicine is, randomized, double-blinded, placebo-controlled studies with large university and medical centers taking place with thousands and thousands of patients. That's not happening. Why? Because there's no money in supplements. Okay, you don't have big pharma behind it. You have usually, right? You have supplement companies, compounding pharmacies. They can't generate the numbers that you would get in a true gold standard type of medical setting. But make no mistake about it. There are plenty of really good. There's a lot of literature out there that touts the benefits of various supplements. Without a shadow of a doubt, but it's just not quite what the medical profession likes to see and hear. Um, and also, you got to know that most physicians don't have any training. Like, I didn't have a class in nutrition. I certainly didn't have a class in supplementation. And I have to give you this little funny story. When I was, and you read about this in my book, which is coming out on the 20th of September, guys. So you'll be hearing about this between now and then. But during my second hospitalization after my infamous back surgery, I had a chiropractor bring in some supplements my favorite supplements, and so I had a little shoebox right next to the counter. So they when the team they went their rounds every day, which is the students and the interns and residents and fellows and the attendings. Say, what's this for? And I say, oh, this is CoQ10. Oh, this is fish oil. And I'm explaining to these guys what this is all about. They look at me like I'm from a different planet. Like, whoa, whoa. I said, don't you guys learn this stuff in medical school? I'm like 20 years above you. He said, oh, no. All we learn here, all we deal here is pain meds and rehab. That's it. And that was, these are people that were much younger than me at the time. So I don't think it's really improved. I don't think most people coming out of medical school and trained today are really vested in supplementation. But we're different. And what about choosing supplements? Okay, I don't go for the cheapest way out. I don't think you have to pay a fortune for your standard supplements, but I don't believe in going to Rite Aid or CVS where they're mass produced, or Trader Joe's. I love Trader Joe's, but it's not where I would shop for my supplements. Whole Foods has put some good stuff, and also Sprouts. You have to know, what name brands to get. You need to do your research, like with everything else. As medical advocates, do your research and pick well-known companies. You have to remember that supplements are not FDA approved like medication. So what's on the bottle may not be what you're actually taking. So that's why I believe in sticking with well-known companies. Like in my office at Heartwise, I have besides selling various products from different companies that are, they're reputable companies, I also have my own line. I work with a special company, and I've created my own line of supplements. I have about 8 of my own. And I can tell you everything there is, 100% when it comes to purity, dissolution, and absorption, 100%. And and they can undergo post-production analysis at any time, meaning an outside company can come and evaluate the constituents of the particular supplement. So we have to be on track. Also, they should be gluten-free, dairy-free, soy-free, because there are people with allergies out there, and also nut-free. So, and also my supplements, don't use any excipients, which are like other things they use to bind them together. You want, other than methyl cellulose, that's about it. So that's how you choose your supplements. Now, I'm going to give you a little quick takeoff on my 5 favorite ones. Not to say these are the only 5, but these are the 5 that I think most people over age 35 should be taking. Number 1, fish oil, omega-3 fatty acids. Number 2, coenzyme Q10. Number 3, vitamin D. Number 4, magnesium. And number 5, probiotics. Now, let's talk about fish oil first, omega-3 fatty acids. And of all the supplements out there, that's probably the one that's been the most studied. So there's a lot of really good information on omega-3 fatty acids. And these are considered essential fats. Why are they considered essential? Because your body cannot make them. You only get them from ingesting from the outside. Now, there's 2 major omega-3s I want you to be aware of: EPA and DHA. And please don't ask me to either spell it or pronounce it, the whole name, because I couldn't do it. I could not do it with justice. But they're both basically EPA and DHA. There's also something called ALA, which is alpha linoleic acid, which I can say easily, but that's a plant source. We see that like in walnuts, chia seeds, and flax seeds. But it's not a great source. It's actually the largest source of omega-3s in the body. However, only about 10 or 15% of it can convert it to EPA and DHA. So I don't really count it when it comes to what I'm looking for in the end result with DHA and EPA levels and blood work. So they both EPA and DHA are very useful because it's anti-inflammatory. These are natural anti-inflammatory agents. When people say, I've got this pain, I got that pain, I say fish oil, more fish oil, because it really has no side effects to speak of, and is a lot healthier for you than NSAIDs, which is non-steroidal anti-inflammatory agents like Motrin, ibuprofen. Those are not healthy for the long term, but fish oil is. Now the fact is, there's EPA has gotten such a big name now because there's 2 major fish oil that's actually Big Pharma has produced. One is called Levesa, and one is called Vasepa. And these are high doses of EPA that are made in the lab, and they're very useful in decreasing triglycerides. So that's definitely a role that we have with fish oil in large doses. We're talking like 2 grams twice a day. So that's commercially available in pharmaceuticals, and drugstores and so forth. Now, DHA is one of my favorites because Really, that's very useful for the heart, the brain, and vision. Those are the three things we really care about as we get older, right? And so I really, I do advanced lipid testing, and I'm looking at levels of DHA and EPA, and I often have to supplement with extra DHA. It's also useful if you're a pregnant female or lactating because it's very good for the baby, fetus, and also baby if you're lactating. The cardiac effects are what we are most interested in, and they have it's a natural blood thinner. It can help thin the blood so that you don't end up with a heart attack sometime. Okay, like we heard about with aspirin, very similar, but to a lesser extent. Also, it has some antiarrhythmic effects. It can actually help suppress, avoid sudden death, in certain patients. So there's really no reason for a cardiac patient to not take fish oil. So other benefits, I've already mentioned one, decreasing triglycerides. It can reduce the risk of certain cancers, and that's like colon, prostate, and breast cancer. And it can also improve symptoms of depression and anxiety. And also, that some people think within their studies behind it, it can reduce cognitive decline. So, I mean, there's no reason to not take fish oil. It has so many great properties. Now, CoQ10, coenzyme Q10, is one of my favorites, and I have to really attribute this to my true teacher and mentor in integrative cardiology, Dr. Stephen Sinatra, who unfortunately just passed away a few weeks ago. Lovely man. I adored him. And we did a study together on earthing and blood pressure control, but he really put CoQ10 on the map. And so what is CoQ10? It's necessary for cellular energy, bioenergetics. Every cell in your body, whether it's a heart cell, a brain cell, a colon cell, an eye cell, every cell in your body has to generate energy for it to survive. When it can no longer generate energy, it dies. And guess what? Then the organ dies and the organism dies. So it's essential for cellular energy. And this is done in the electron transport chain in the mitochondria, which is the powerhouse of every cell. So this goes on without our thinking about it. Our bodies do produce CoQ10, but as we get older, we don't produce as much of it. So we could always use some extra. And if you happen to be a cardiac patient, you've had heart muscle damage, you have what's called a nutritionally deprived heart. So we definitely have to supplement there. But everybody can benefit from supplementation with CoQ10. It's also very important in people that are on a statin because statins, which are used to decrease cholesterol, LDL cholesterol, also, unfortunately, will decrease your CoQ10 levels in your muscles. You probably heard that people have like sore muscles or muscle weakness. They got to stop the statin. That's because the CoQ10 levels are going down. So whenever I do prescribe a statin, patients walk out of my office with CoQ10. It's important. But there are other possible, it can also be useful in migraines, okay, in large doses, also relieving symptoms of Parkinson's disease and depression. So it's a good adjunct because it does have, it helps, it does the opposite of oxidative stress. It actually improves oxygenation. So in Parkinson's and depression, also has an anti-aging effect. So in summary, it's very important for heart health and function, and it can also enhance your overall energy levels. And it also it's an antioxidant in itself. It's an antioxidant. And again, it can replenish levels of CoQ10 in patients taking statins. And also beta blockers tend to have decreased energy because of the drug medication inherent in the medication itself. So it can be useful there as well. Vitamin D, that's my favorite vitamin, right? And there's vitamin D2 and D3. D3 is really what we're most interested in, but 42% of Americans lack or have diminished levels of vitamin D. 42%. If you're Black, 82%. If you're Hispanic, 69%. The darker pigment with melanin actually helps deflect the absorption of sun into the vitamin D. It might be activated. We all have vitamin D in our skin, but it has to be activated by the sun for it to really do its thing. So, you know, the best way to increase your levels is to be out in the sun for like 20 minutes a day, exposing your arms and legs for most of the year. I don't think people in Chicago and New York are going to be doing that. Uh, and again, you need to expose both your arms and legs. It's not practical. Supplementation is important. And I do look at levels. Now, if you look at most labs, they say a level less than 30 is cool. It's not cool. Sorry. A level greater than 30 is good. Now, the span is 30 to 100. Now, why would you be 30 if you could be 100? So I kind of am like a middleman. I like it to be between 60 and 80. Those are kind of the numbers I shoot for. because I think vitamin D is more like a hormone than just a vitamin. It has potent anti-inflammatory properties, potent. It's also been shown, this is very interesting, in many studies, that patients with low D levels have greater risk of heart disease, cancer, diabetes, dementia, and various autoimmune disorders such as multiple sclerosis. And vitamin D has even been linked to all-cause mortality. It's just not a good thing to have deficient levels. And something else, again, I've talked about the inflammation, but we know in the last 2 or so years with COVID that patients that do poorly with COVID have low levels of vitamin D. And I had a patient, I'll bring this interesting little quick snippet here. He, about a year ago, he was African American. His level was like 17. I said, dude, you got to change this. You got to take vitamin D. He didn't listen to me. So about 6 weeks later, he ended up in the hospital, county hospital, with full blown COVID, intubated. He did survive, but barely. He was in hospital for several weeks and has had a lot of long COVID symptoms. And I saw him and I rechecked his level. It's like 18. I'm saying, are you serious? What does it take? So if you're black or dark skin, you really need to even be more cognizant of getting your levels drawn. You must get your levels drawn. And I don't care what anyone says, Medicare will cover it. And the ICD-10 code is E55.9. So tell your doctor that. So the only time I would caution against using high levels of vitamin D is people that have kidney stones, because about 80% of kidney stones, if not more, are comprised of calcium oxalate. So obviously, too much calcium. One of the ways in which vitamin D works, it increases calcium absorption from the gut. So we might not want that if you have kidney stones. Also, a condition called sarcoidosis and various lymphomas. But other than that, it's very safe. Magnesium. Number 4, magnesium is the most abundant mineral in the body. Actually, it's the fourth most abundant mineral body, but it's probably one of the most important because it's used in like over 300 chemical reactions, enzymatic reactions in the body. It's that important. And measuring levels is really pretty useless because about 60% of magnesium is in the bone and also in muscles and soft tissue. So very few is in the blood, in the plasma, which is what we look for when we do blood work. So, but it's very, very important. And it's vitally important also in energy creation. We talked about energy with CoQ10. What magnesium is important, it helps to convert food into energy. What is food? Food is energy, but it has to be converted into energy. It's a chemical process, and magnesium is involved with that. Also helps in protein formation. We can't live without protein. It also has an interesting role in gene maintenance, helps to create and repair DNA. Our DNA, our genetic material is always being like disrupted, right, by the environment and things that are against us. And so having adequate magnesium helps to repair that. It also helps with muscle performance, okay, to helps muscles to both contract and relax. Very important if you're an athlete. And also helps with nervous system regulation. So it's really important. Some of my favorite things about magnesium that you might not know about is exercise performance. It actually helps mobilize blood sugar into the muscle cells while you're actually exercising. And that will also help to dispose of lactic acid, which is that acid buildup that causes pain when you're running or doing something repetitively. So it can actually improve exercise performance. It can help fight depression. Okay, magnesium plays a big role in brain function. And it's very important that for it to really enter the blood-brain, the brain itself, you want to take something called magnesium threonate, THRENOT. Anyway, it's a component of green tea, and it's very useful. Um, One of the reasons I like to speak so highly of magnesium is because it has a role in arrhythmias or palpitations or extra beats, and that's one of the most common things that bring patients into a cardiology office. So what is a palpitation? What is an irregular rhythm? So it's an abnormal conduction of electrical impulses. Your heart is an electrical organ, and it runs on these electrical impulses that can be dispersed haphazardly because of some inherent problem in the conduction system. That's a disturbance, and magnesium can oftentimes help that. It can help relax that. And so I use it a lot for quite frequently in patients with palpitations, and actually can be very helpful. It's a must for my patients. Another thing that I really like about magnesium, it helps with sleep. Okay, sleep is a big issue these days. I think over 50% of the population is not getting adequate sleep. That affects your cognitive performance and also how you age. So how does it do that? It decreases cortisol, We already know that cortisol is the stress-like hormone. You can't live without it. But then again, too much of it is not good, especially when it comes to sleep. And it also, magnesium binds to the GABA receptors in the brain. And the GABA receptors, see, GABA is the calming neurotransmitter. It's not excitatory, it's calming. And you want that when you're trying to sleep. So magnesium is very useful for that. And the last one I want to talk about is probiotics. And I don't think anybody will disagree now that gut health is more important than we ever thought it would be. I mean, really, the thing that I say in functional medicine is that you're only as healthy as your gut. If your gut's not healthy, you're not healthy. It's like your second brain. And we didn't really appreciate this. This is the last 10 years. I learned nothing about this when I was a student. And even as an intern and resident, it's like, okay, digestion system, it's for, digesting, absorbing nutrients, and then disposing the rest in your waste. But that's not really true. So if you look at bacteria, and there's some fungi as well, there, you and I, all of us here, we're comprised of 10 trillion cells. There are 100 trillion bacteria living within us, mostly in our colon, but in other areas as well. So if they outnumber us 10 to 1, so it's a pretty important relationship. As long as we take care of them, they'll take care of us. And the benefits of having a healthy microbiome, which is what we get when we take probiotics and watch what we eat, is that it can help with weight loss and digestion and enhance immune system and neurotransmitters release. So here's why. You might not know this, but 80% of your immune system comes from the gut. Again, and we test with we do something called a GI map, which is a stool test, and we see exactly where you are on the how's your immune system. And most people that have a leaky gut have a diminished immune system. It's that simple. So what's the leaky gut? When you have the good bacteria outweighed by the bad bacteria, then you got a problem. Say you got 100 trillion bacteria living within us. If most are healthy, we can handle the bad ones, okay? Because we can't fight the environment or some of the food that we eat or our stress. I mean, we can do our best, but a lot of factors against us. So with the probiotics and the healthy lifestyle, you promote good gut health. But and the bad outdoes the good. You got leaky gut, you got problems. And then your immune system is diminished and your neurotransmitters get screwed up. When I have patients that have chronic fatigue, chronic insomnia, depression, it behooves me to look at their gut function to see if that plays a part. I have a patient that I saw. She's an elderly lady, been my patient for many years, and she was recently diagnosed as being bipolar. And she had major gut issues, major. And we're just getting to the root now. I'm hoping by repairing her gut, that we'll also be repairing some of the neurotransmitter imbalance she has in her brain, because the medications are not that great. You probably heard about that. So not my favorite. So that's basically what we talk about, my favorite supplements. And so the thing is, well, how do you know you're taking the right amount? You can do certain testing. And I always believe in test, don't guess. Your standard blood test by LabCorp and LabCorp and Quest is not going to do it, because they are looking at the concentration of a substance in the plasma of the blood, which is the liquid portion. That tells you nothing at all about nutritional status. You have to look at the cellular level. And one lab that does that beautifully is SpectraCell. I don't know if they're trying to make a comeback, but there's another lab that I'm starting to use called Vibrant America. They do micronutrient testing. Genova does something called NutriEval. So they're specialty labs that you generally have to go to a functional medicine doctor. Your standard doctor is like clueless. They don't even know what it is. But you can test to see whether you're getting adequate nutrients, which include things like vitamin D and definitely magnesium and things that you won't see with a regular test. So that's important to test, because if you're an athlete and you're just working out a lot, you could be really diminished. I had a patient years ago. He came to visit me from the Bay Area, and we did his testing, and he was like really low, and he couldn't say, I eat healthy. I said, you're burning up so much. You're burning up so much, and you're generating too many free radicals. You need a lot more than the average person. So it's all about your individual performance and your own requirements is what we take into consideration with functional medicine. So thank you. And let me look at these questions. I have my glasses on. You guys help me with these. Okay. What about the vitamins that have coatings? Anderson's going to break it down. Yep, you're right. That's a good question. Well, what happens is that your body doesn't break it down, and it ends up in your stool, in your poop, or it ends up, in the urine. Your body can't break it down. That's why I don't use excipients and the supplements that we use, which means the only thing in it would be methylcellulose, nothing that has a coating, or 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 vegecaps. Vegecaps are also good. So you have to be very careful, and that's why I don't go for the cheap brands. Okay, because you will have that problem. You shouldn't with better brands. Okay, I use a diabetic sensor that advises against using vitamin C. Anything else that could take its place? I didn't list vitamin C as my top five, although I do think it's important. I do take it regularly. Um, Interesting. Why would a diabetic? So he's talking about these sensors. You probably heard it. They're called continuous glucose monitoring. You put them like in the back of your tricep or something like that. It's a great test because you get to see what foods actually cause what rise in blood sugar. So it's very useful. I don't know about why they advise vitamin C. That's really important. I'll have to research that. It's the first time I've heard of that, actually. Why would vitamin C be not ill advised? I don't know. Please give me some time to think about that. I will research it for you. Okay, Amy, what types of magnesium do you recommend? Okay, don't use magnesium carbonate or the magnesium that's found in milk of magnesia, because that will definitely have you going the wrong way. I like magnesium. Um, what's it called? Oh gosh, it's starts with the C, guys. I always get these brain freezes when I'm on live here. It'll come to me. But usually, if you use a good brand, you're not going to get the problems with diarrhea. You wouldn't have worried like the cheap brands, but I use a chelated brand of magnesium. It's from I think Designs for Help and for Health. Um, and I'll try to remember the name before the end of the program. But uh, magnesium's inexpensive. Now, if you're looking for a brain, okay, if you're looking to get into the blood-brain barrier, then you want to pick something like magnesium threonate, threonate, because that will actually penetrate the blood-brain barrier. Your average magnesium won't. So it really depends on what you're looking for. Um, but I'll come back with that name in a minute. Okay, my son's 18 and slim, very healthy. He has C19 at the moment. Should he increase vitamin D levels? Okay, C19. He takes 5,000 at his level is 19. Yes. Okay, that's why units. That's why levels are important. My level was like 18 when I started. Okay, it was really low, and I take 10,000 units every day, and I check my levels frequent. Well, I check them at least twice a year. And so checking levels is very important, but you have to go to what your needs are. I mean, and also because I've had like basal cells, so I can't like just sit out in the sun and without a sunscreen, and that also will make a difference as to the absorption of vitamin D. So my levels tend to be low just because I have to wear a sunscreen. So go by your levels, okay? Because you're not going to feel any different. But go by if your level is 19, keep going. Some people need 15,000 units a day. It really depends on the individual. Good question. Is there reputable vitamin versus multiple? Um, Actually, I don't take a multi. Can you believe that? It's not that I don't believe in multi. I try to carefully make a choice. Now, that said, I do have a product that I have my own called Immunowise, and I put that out at the beginning of the pandemic. Wearing a mask, washing your hands, isolating from others, all the stuff that really isn't good for you, but we had to do it because we didn't know much about this illness, and who was high risk and who wasn't. But what they didn't tell you about was how do we improve our immune system? But it's an immune system problem. And even Fauci, it took him like 8 or 9 months to actually admit that, oh, yeah, vitamin D is really important. Like, really? So I had vitamin D, vitamin C, N-acetylcysteine, quercetin, which is a natural anti-inflammatory agent, and zinc in my Immunowise product. It's not a multivitamin, but it's the closest that I have because I think building an immune system is very, very important. So there are some really good multis out there. Again, I would look for very good company, Pure Encapsulations, Orthomolecular, Zymogen. These are the better companies. And you generally have to go to a doctor's office where those are sold. But at least you know what you're getting is on the bottle. Okay, the bottle that you're taking. So it's really useful. What's your latest? Oh, my latest book? Oh, my book. Okay, so I have a launch date. Okay, it's the 20th of September. So I'm going to be doing a lot of announcements on social media, and so please look for that. And I'll give you that information at the end of the program because I really need your support. I need everybody to go on Amazon that first day, which is the 20th, which is a Tuesday, and purchase that book because that's how you get high ratings. Is that first day, that the 20th of September. I need everybody to go there and get a book. And it's not, I think it's $18.99, something like that. Oh, by the way, if you're one of the 50 first people that get it, you get a bottle of Immunowise free. Okay. So if you're the first 50, so it's worthwhile going that way on the 20th. And I'll be reminding you guys. Okay. Let me see. Do I like Myers cocktail? Absolutely. Myers cocktail is an IV. I have an IV there. I have an RN that comes to my office twice a week. So it's all natural. So it's basically high dose vitamin C. We're talking like 20 grams or plus, not milligrams, grams. B vitamins, zinc, minerals, calcium, magnesium, and we can put in other things as well. But it's very good for actually for fatigue and for just kind of getting people back on board. So I'm a big fan. It's not covered by insurance because it's all natural. There's no drugs in it, so insurance won't cover it. But it's really important. People that have autoimmune disorders that are trying to help, or excuse me, gut, leaky gut, so forth, and to get them started with energy and so forth. It's a really good energy booster. And it's all natural. So I'm a big fan of Myers cocktail, and we do it in my office. You can get a CGM without a prescription, I think. If not, I'll give you a prescription. It's just your insurance won't cover it. Your insurance won't cover it. But I think I was involved peripherally with a study last year, and we were measuring blood sugar levels in patients, participants. There's athletes, so they purchase their own. So you don't have to. You don't have to have a prescription per se, but you have to just pay cash for it. I think I can find that out for you as well. Citrate, yeah, magnesium citrate. But the other one that I'm thinking it's another one, not magnesium citrate. But thank you for helping me out here. Okay, glycinate. Thank you, Amy. Thank you. Brain freeze. What can I say? I like magnesium glycinate. It's easily absorbed. It's the absorption is great. No diarrhea, no GI problems. So that's one. Citrate's okay too, but I think glycinate's the best. And let's see, did I get everybody's questions? This is great. Great audience. This is a really practical question because you can go overboard with supplements and, like I said, have expensive urine, or you can believe what they may want you to still believe that there's. And here's what I didn't mention. If you look at the studies on supplementation, which I mentioned before, the reason why, if you look at the studies that actually make it into peer review articles, you'll see that the conclusion will be, oh, they didn't really help. Or sometimes you get, oh, they actually made things worse. Now, doctors don't have time to scrutinize studies. I had some great teachers, and I still scrutinize studies, even to this day. So I have to ask myself, okay, what was the age of the participants? Were they older than they should? In other words, once you're 70 years old or so, there's going to be a high incidence of heart disease and diabetes anyway. What is the mix of male and female? What was the dose that they used for particular supplements? Oftentimes they will underdose. The dose they use is not the dose that we use in clinical practice. So the end result looks like, oh, well, not really so great, or not. So then the media gets wind of this, and it's promulgated throughout the land. And then patients are coming to me and they say, oh, doctor, I told the vitamin C is not that great, or, vitamin D is not all cracked up as it should be, or same thing with calcium or various supplements. And maybe I should just wait, And the end method that people end up having is that, just wait, don't take it. It's not really good for you. Just wait to get a disease and we'll find a medication for you. Seriously, why are we waiting for disease? That's traditional medicine. We go beyond that. As medical advocates, we talk about disease prevention. So that's why we do supplement when necessary. But it is supplementation. It's not and substitution for a meal is to supplement your food source, and that's really important. I think any other questions? I think it's true that if you have a handful of vitamins, some could. You have to. Yes, that's a good point. It's true that if you have a handful of vitamins, some could counteract the others. Yeah, that's why you have to know what you're taking, and why I don't believe in taking everything, including the kitchen sink. And then creatine monohydrate. Yeah, that's a great supplement. This was meant to just give you a primer of the five that I really like. Um, there's many other that I take other ones as well, but I didn't want to bore you with that because I think this is everybody can benefit from these five supplements that I've just mentioned. Everyone can benefit. Creatine was really important. Really, like 20 years ago, it came out, maybe 25 now, for building muscle and so forth. It volumizes the cell. So as you work out, it adds more. It doesn't so much increase your muscle mass. It increases the volume within the muscle cell, so you look bigger. But I've been doing some recent reading, and it looks like it's very useful, and for cognitive function as we get older and so forth. So that's one of my new projects, to do some more learning about the positive effects of creatine monohydrate as we age. That's really what I'm interested in. I always say I don't want a good heart with a bad brain. So that's a lot of good stuff happening with that. Okay, glucosamine, chondroitin sulfate for joints. I've used it in the past. It's expensive. I use fish oil. And I use turmeric. Those are my go-to anti-inflammatory agents. Um, I don't take chondroitin sulfate or gluten, but some people swear by it. If it works for you, get it. It tends to be a little pricey sometimes, so it's not my favorite. But again, it's a definite option for you. And there's so many supplements we could talk about, so I kept it really simple. So anyway, listen, I want to thank you guys. I guess we're finished now. I don't know if I'll have another one until I'm going to be very busy the next few weeks. What's your thought on omega-3 versus krill? Good question. I have to answer one more question. Krill has been used more for arthritic conditions. Okay, the literature behind krill is not there, not like omega-3 fatty acids, like DHA, EPA. I don't even know how you can, equip, how equal they are to one another. So I stick with what I know is good. Some people love krill oil, and that's fine with me. But if you want to go by what we know from the literature, omega-3 is where it's at, the EPA and DHA. But some people add the two together. Again, that's another option for you. Okay, so listen, guys. So my launch date is the 20th, which is a Tuesday. I may have one program beforehand. I'm not quite sure because I'll be very busy doing the pre-marketing stuff for this. So if not, we will start in right around that time, and I'll give you a little synopsis of the book. We'll probably do that in a few sessions. But in the meantime, so where will you hear about this? Heartwise. My website is heartwise.com. Facebook is Heartwise Fitness and Longevity Center. I'm very active on Instagram. That's Doc H. Elkin, DOCHELKIN. I do all my announcements on Instagram, and then also I share them onto my Facebook page, and of course the website. And so be on the lookout, and hopefully you all go to Amazon and get my book. It'll be available, and let's make this a bestseller. Thank you so much, guys. Appreciate your help, and we have exciting times coming up. Thank you, and good night.